Oscar Willis here from TheMacLife.com. Today joined by Professor Yaneer Bar-Yam. Professor, thank you so much for joining me. Professor Bar-Yam is the founding president of the New England Complex Systems Institute, where he's an expert on pandemics and other systems. He's the author of, I believe, over 180 research papers in professional journals, and is now spearheading the efforts of over 5,000 volunteers working to stop the outbreak of the coronavirus at endcoronavirus.org. Professor, once again, thank you very much for joining me.
Thank you for having me.
No problem. If you don't mind, could you just give the people watching this sort of a bit of an idea of your background, specifically when it comes to pandemics and outbreaks of this kind?
Sure. So, the origins of this is in a study that was done 15 years ago, where what we showed is that the increasing global transportation is leading us to a transition from local transmission to global transmission. Now, that's obvious, right? If people travel around, they bring the disease with them, and so we end up with, this kind of long-range transmission where something that happens in China can affect everywhere else. But what the study showed us was different. It's that there is a point at which you go through a boiling point, or a tipping point, people call it, where you go from one type of behavior to another type of behavior. And what that means is that as you get close to this point, things change dramatically. It's not just a little bit, they change a lot. And that was a very important realization that we tried to get people to take seriously. Mm-hmm. And so I've been talking about this for 15 years. In 2014, in January, I spoke to the World Health Organization, right? They're responsible for responding to outbreaks around the world when they're, major events. Mm-hmm. And while I explained to them this, it's very hard for people to act, as we see today, recently, it's very hard for people to act unless they experience it themselves. Right. So, if they look back at the history, then they think of what the world is like, and that tells them what they should do in the future. And in this case, it's wrong, right? Because if you're going through a transition, then the future is not going to look like what the past looked like. And indeed, 2 months later, Ebola started in West Africa, and it was 10 times the size of what people had experienced, right? Mm-hmm. So you had cases of few hundreds of deaths, and all of a sudden you had 10,000 deaths. But that wasn't all. People were expecting at some point that there would be 10 million deaths. Wow. And so what we did, actually, the reason why it was stopped, and we recommended this, but actually people who did it, they didn't know about our recommendations. They just did it in a natural way. What we recommended is that the communities should be responsible for themselves. Instead of waiting until people went to the hospital and said, hey, I have Ebola, and people there said, they tried to act on it, what we did is we had people, we didn't do it, but they did it themselves. They went around in the neighborhood and they measured everyone's temperature. Mm-hmm. And if they had temperature, they isolated them, and that stopped the outbreak. So what happened is it went up, and then it went down. So we explained this to people. They just did it naturally, and it stopped the outbreak. Now, we learned from this 2 lessons that are really important for what's happening today. The first lesson is that people have to take responsibility for themselves. There's no government agency, there's no international agency that can stop an outbreak if people don't do it themselves. So right. Everybody has to take responsibility, and everyone has to understand that their responsibility matters. The second thing that we learned was that we can stop it. That the fact that it starts increasing has to do with the fact that there's contagion. If we stop the contagion, then we can stop it, and we can make it go away. Mm-hmm. That's really crucial. So those are kind of the lessons that we learned, and I've been working in other areas in outbreaks, and when it started in China in December, January, recognizing that it was a major global risk, we started warning about it, and that's how I began to be involved in this one.
So going off that, we're talking about people taking responsibility for themselves and self-isolating and stopping the spread. I think you're referring to sort of flattening the curve as it's sort of become to be known. On March 21st, you wrote an article saying that really a 5-week total lockdown is the best way to sort of get this nipped in the bud correctly. Looking at your thoughts now to looking at your thoughts then to now, as it were, how do you think the global response actually has been to this pandemic?
So this is where, it's really important to go all out. If
Right.
you don't do it all the way, and this is not flattening the curve, this is crushing the curve, and maybe
Right.
that's for this audience too, because it's really about, going all out. And people understand that in a competitive sport, right? If you don't go all out, you're not going to win. And this is the toughest, absolutely toughest enemy that we've ever seen as far as we know in history, right? It's attacking everybody around the world. It's like nothing else that we've seen in this continent, and fast, right? So the fact that it works fast and happens within weeks is really very different. It's not like any epidemic that we've seen. Even the old pandemics that killed many people, they didn't work this fast.
Wow.
So, so we have this super fast adversary. And the answer is, if you don't act super fast, you're not going to win. And that's what I'm worried about. That's what I've been worried about. But the point is that this is one of those cases where if you anticipate and you act early, the earlier you act, the easier and the less you get hurt, right? If you anticipate in a fight what someone is going to do, then you can get away and you may not even be hurt at all. But here, everybody's kind of waiting. Am I going to get hit? Am I not going to get hit? And they kind of wait. And once the hit happens, well, now you've gotten hit. So now it hurts and a lot, right? Why would you wait? So that was one of the questions that I kept asking people. We know that it's coming. We can see it coming, like a wrecking ball. So why do you wait until you get hit before you act? And unfortunately, people waited. So now we're getting hit, and all over the world it's happening, right? Instead of, if we had anticipated, we could have stopped it, nipped it in the bud. It's the ounce of prevention. But it's really just about anticipation, knowing ahead of time what you're going to do and then doing it early. But what's happening now is now people are acting. But the key is, are we acting enough? The problem is that we can't see everything that's going on.
Mm-hmm.
Right? We can't see what people are doing, every day. And we can see some things that lead me to be concerned, like travel restrictions are not being implemented strongly enough, and travel restrictions even within countries. And I know Conor mentioned this in his video, that we need very strong travel restrictions because it super helps. And if you don't do everything all the way, then, so now you're kind of almost there, but it just keeps going and going and going and going. So the key is go all out, stop it, and then 5 weeks from now, we're done. So I don't know right now. So in Italy, for example, had a national lockdown. And after a week, it kind of looked like things were leveling off. And then they jumped up again, really a lot. And what happened, the people who were observing it, who were involved in advising it from China said, well, they're not just, people are not taking it seriously enough. We got to take it seriously. So the key here again is go all out, be very clever, think through what we need to do in order not to transmit it. And in order to not to transmit it, we have to take actions in a very way I can tell you if you want to ask. But the point is that if we go all out, then we know we can beat it. And the fastest we can beat it is about 5 weeks. And if we do anything else that doesn't work, it'll take forever. So we do all out, we're done in 5 weeks, and we go back to normal life. That's what we want.
So when you said that, essentially this comes on, we need to act socially responsible. Unfortunately, the way the world is, there's lots of people who just won't do that and who don't want to do that. So when you see pictures, for example, in Florida of people still on the beach, or you see in Ireland and the UK, people until very recently still going to the pub or the parks, do you think at some point government officials need to say, you can't be trusted to act responsibly, so you're staying inside. And I kind of mentioned military intervention. Perhaps do we need to go to that sort of level, do you think, to get this done in the past?
So there's always a small percent of the population that doesn't respect the law, doesn't respect, the life and all kinds of things. So there are always some amount of crazies around and some amount of people won't. So sure, there is need for that, but it really should start with communities.
Hmm.
Everyone should be calling each other and saying, what are you doing? I'm doing this. Can we do anything that will make, and also helping each other, right? Because if people are locked down, then, some people can offer help and some people can give help. And again, it's all non-contact, right? But, helping each other with things that they need and will make it easier for them during this tough period. And it is hard for many people. And it's hard because people are alone and lonely, and it's hard for people because they need something. Everybody has something that they can be helped with, and everybody has something that they can help with. So reaching out to everybody that you know and trying to figure out who's around, that there's nobody around that they are being helped by. Community totally matters in this context. So that's part of the things that we really need to be doing right now.
You mentioned in one of your last answers that I could ask you what we need to do from this step on. So what is, we could have gone into total lockdown and got this done in 5 weeks. That's clearly not happening up to now. So what, in your opinion, is the best next logical steps for countries to take and for people to take?
And again, it's really a question of going all the way. I mean, the point is that as soon as we get it right, it's going to take 5 weeks from there. So let's get it right, and then it'll be 5 weeks. And we may have we may have slowed it down a little bit, but in most places, we're not doing it well enough. Even in China, when they did it at first, let me give you an example. They had everyone stay in their apartments, and people would go out every 3 days to get groceries or other necessities. But they really were able to crush it when they were able to arrange home delivery.
Right.
So instead of people going to the supermarkets, they got home delivery. The other thing that they did is they made sure that people were tested, early symptoms, and they took them out of the home. So this is a tough thing to understand, but 80% of transmission was within family groups. Okay? So even within the family, even within the home, social distancing, staying distant, being somewhat isolated. And if you have people who can, go out and camp on the front yard or whatever you need to do, if you can separate the people, it won't transmit.
Right.
So finding a way to reduce transmission within families is the big win here, because that will really dramatically. So China started with 800 cases when they did the lockdown. They ended up with 80,000.
Wow.
And the 80,000 is just the trajectory, right? Because what you see now is always just tip of the iceberg, because it transmits so fast that 1 week from now, there are 10 times as many cases as there are today. 10 times. So you don't see that. So this is why everyone's behind, because they say, hey, it doesn't look so bad. We don't have to do anything, right? It doesn't look like they're hurting me. They're trying to hit me, but it's not working. And then all of a sudden, slam, right? Because 1 week later, it's 10 times. So we have to act in response to what's going to be a week from now or 2 weeks from now when it's 100 times, right? Because it takes time to do things. So the key thing is not to waste an hour, right? If you can do something within an hour, or if you can do something within a day, do it.
Mm-hmm.
So, if there are people who are doing essential things like healthcare, or they're working in supermarkets and so on, they're more at risk. So we have to separate people so that they don't transmit it. And we have to do that in the places where people are working. So supermarkets arrange outdoor pickup, standardized packages so that they don't have to pack all kinds of special things. Try to make it easy and simple for people to do their work, and try to make it easy and simple for people to get what they need. And so companies have to think about it. They have to think about their employees' safety, how their employees are faring at home, because if their employee is at risk, then that puts everything at risk, right? So all of these things take a lot of thought and attention, and the point is, do that now. Don't wait until you say, "Hey, all right, you've convinced me. Now I'll do it."
Right.
Okay. So that's really the key, and that's what I've been saying since January. Now that everyone sees it, let's do it now.
You mentioned there about sort of frontline staff, and before we started recording, we were saying, celebrities sort of coming out like Conor McGregor did and using their platform effectively is good when they do it effectively. Conor donated €1 million to his local frontline staff to give them the equipment and supplies they need. How important is it then for those sort of frontline staff to be properly equipped in this situation?
Everybody, you have to, I mean, this is an all-out thing. Everybody's at risk. And surely, I mean, I don't know which you meant by frontline. What are they doing? What are they doing?
So for example, across America, for instance, we're hearing about medical staff who just
Oh
don't
yeah,
have masks and doing stuff like that. If we're talking about self-isolation, but then if we don't equip our medical staff with the correct stuff, are we not just defeating ourselves over and over again?
yeah. And medical staff are really, they're taking a huge amount of risk, and many of them will get sick, and many of them will die. And if they have the proper equipment, that's going to go way down. So having them have the proper equipment matters tremendously. And in terms of what Connor has done, everybody, to the extent that they're able, should be standing up and be a leader. And I think that Connor has modeled that for everybody. It's not just what he's done. We should understand that everybody needs to stand up and talk to everybody that they know and make sure that they understand that this is life-threatening, that this is society-threatening, that this is a global problem. We're all in this together. Act now, we can stop it. Why not? So again, there are three things that we need to know. It's a terrible disease. It makes people really, really sick. Some people get away with nothing, but many people get really, really sick. The second thing is it's really fast. It grows super rapid. And the third thing is if we act now, we can stop it. So why not? That's the point.
Fantastic. I've only got a couple more questions because you've been very generous with your time already. I think for a lot of people, we mentioned, some people struggle with self-isolation and they find it difficult. I think for a lot of people, one of the reasons why it's so difficult is because there's no end in sight. There's no concrete date where they can go, okay, like if I just put up with for now, July 30th, I'm out or something like that, At this point in time, the world changes every day. But in your best estimate, when could you sort of safely say, right, I think is it August? Is it July? Is it September? When could we potentially be out of this?
So first of all, if you self-isolate, 14 days later, if you don't have symptoms, you don't have it. And if there's someone else who's self-isolated for 14 days, maybe a close friend or a family member, it's quite safe for you to be with them. So that opens the possibility of getting together with one. I wouldn't do it with a lot of people. And if the rules about, you don't want to have people think that you're doing it casually, right? But think about it, 14 days and you know that you don't have it. If you're really strict about the isolation, then the people that got infected in the first 14 days of isolation because of the family groups, because people are together, we have to wait another 14 days. By then, it's still already going down. And another week later, we're done with it, 5 weeks.
Right.
Just because it's the tail. And places that are not as strongly hit, if we have these travel restrictions and we're not worried about cases moving around, then by 4 to 5 weeks, they're done. And they can start going back to normal. 5 to 6 weeks in the hardest hit places. And then everyone's going back to normal. So the point is that we have to hang in there. 5 weeks, we will really already on the way out. And maybe 6 to 7 weeks as people check, are we really there? Being really careful, so on. So surely by 2 months, we're really on the way to normalcy. But the last few weeks, we already can relax some restrictions, and we can start going back to normal. And so if you think about it that way, here's the thing. If anybody's breaking the rules or if anybody's doing stuff, they're the ones who are going to be keeping you in longer. So let them know, hey, don't do that. We really want to have this stop. All we have to do is hang in there for 5 weeks and talk to them.
Very good. So just to be clear then, you think travel restrictions are one of the most important things, it's even inside a country itself?
Yeah, the reason is that if you impose sort of boundaries and travel restrictions and say only essential, I mean, Ireland is a small relative to many other countries, but if there are parts of it where you have more cases and parts of it that you have less, and you're careful to only allow essential travel across the boundary, then that's the point where you can say, hey, this area, we didn't really get that many cases, and we already know after 3 weeks that we basically have none. Now we can start relaxing the restrictions. That's a huge win.
Cool. And just the final one, and this might be sort of a bit of a quirky question to ask you, but the UFC, which is a mixed martial arts organization, the owner, a guy called Dana White, has been adamant that he will have an event on April 18th. And it's been moved from every state that because they can't have this many people here and this many people here. April 18th is essentially just over 2 weeks away. Is there any real logical chance that an event can be held safely with fighters coming from all over the country to one location?
No.
That's
All
okay.
he has to do is wait month, 2 months, and everything will be fine. We need another month or 2 months, and that's really the time scale. It's not forever. It's not next year. A little bit of patience now will pay off a lot. And the last thing that will go away are restrictions on big gatherings, because you don't want to have super spreader events where hundreds and thousands of people get infected. But if we are patient about it, we'll be able to do all kinds of exciting things in a few months. Maybe that will take 6 months to happen, just because we want to make sure that we don't go back to something terrible.
Professor, thank you very much for joining me. And I'd like to remind the viewers
Before
that.
before you
Oh,
go away, I want to talk about one more topic.
oh, please do.
There is one topic that is really important because the disease has a very particular behavior. People get into mild cases, and some people stay mild, and then they just get better, maybe about 80%. The 20% that don't stay mild, they may be mild for a week or two, many of them, and then they start getting severe. And they end up in a hospital and they can't breathe, and they are, of the total, about 6% end up getting on ventilators. It's a really bad thing to happen. So we've been trying to think, since again there's a sensitivity to how healthy you are. And that turns out to be really important idea, because if instead of thinking about the cure, you think about the health,
Mm-hmm.
then you may be able to make people so that they won't end up going from mild to severe disease. So what do you have to do? And the basic first thing is you just follow the rules of health, right? So the rules of health are: you drink a lot, especially when you have a cold, right? You eat well, the right foods, soups are great, right? And everybody knows how to take care of themselves because they were told by their mother or their grandmother or whoever is the right person in their family who tells people how to be healthy. So think about that and focus on it. Sleep well. One of the things that people don't know is that it's okay to get a fever. Don't take medicine for fever as long as the fever is not high, because that's your body fighting the disease. And you want to give your body as much chance as possible to get ahead of the disease, because your body is fighting it. The other thing is, this is a respiratory illness. So it's about your lungs and about how healthy your lungs are. So do exercise, right? And I think that's really important for people who care about mixed martial arts. Make sure you are healthy, right? Do the aerobic exercises. You don't have to wait till you're sick to do them. If you do them, but surely if you've never done them, this is a good time to do them, because even if you get the disease, it'll help you get over it okay. And there's one other thing that I would say. So aerobic exercises, deep breathing, breathing out fresh air, clean spaces, wash your clothes, things that keep your area clean, because if you have it, and you can have it even if you don't symptoms, cleaning up removes the virus from your environment, and then you don't breathe it in, even if you're the one who breathed it out. And that brings me to the last thing. We've been trying to think about what we can do to help people. And one of the ideas is that, let's say you have the illness and you're breathing out the virus. Well, then you're breathing it back in, right? So go outside, fresh air, breathe it out in one direction and breathe in the other direction. Breathe it out in one direction, breathe in the other direction. Then you don't rebreathe your virus, and maybe that will help prevent you from getting more infected. So these are just ideas, but they make sense. And if people do them, even if we help a little bit, because so many are getting sick, it may make a huge difference. So that's what I wanted to mention. So take care of yourself, be well, and I'm looking forward to the next chance that I have to participate in activities that we're doing together.
That's great. And I just want to remind everyone, if you go to www.endcoronavirus.org, you can join as a volunteer to help sort of work with you and the other 5,000 people to try and get this squashed.
Yeah, what I did is I said, I saw that people were not doing the right thing from the beginning, and I saw it was going to get bad, and I said, look, we need a lot of help. Everybody's got to come on board. So I sent out a note asking for volunteers. You're welcome to join us, whatever you do, whether you're involved in communications or whether you just want to help neighbors to learn about how to do things. We have lots of guidelines. So you sign up. We'll share, we have the information on the website, but if there are any questions you have, you'll be able to come to us. And if you want to participate in a strong way, technical people also welcome. We're doing engineering projects in order to help improve things all across the board. Anything you do, you're welcome.
Fantastic stuff. And thank you very much for doing that. I think, as you said at the very beginning, and as I think a lot of people need to understand, is that this isn't going to go away unless we're all in it together. It's either do it properly or don't do it at all, almost, So thank you very much for starting that. And thank you very much for talking to us today. Really appreciate it.
Take care.